Good morning. Is everyone good to go? Maybe just keep a little bit of distance. Everyone's good to go? Good morning. Natasha, Fyles, Minister for Health. I've got an update for Territorians. We have 48 Territorians in Territory hospitals. We've got 22 in the Alice Springs Hospital, 4 in the Tennant Creek Hospital, 1 in the Nhulunbuy Hospital, and the remaining 21 are in Royal Darwin Hospital. But pleasingly, I'm able to report that we don't have any of our patients in intensive care. We did have 1 Territorian in intensive care, but they have now gone to a ward, as I understand. Of these patients in Territory hospitals, 7 are classified as acute cases and they are receiving oxygen. So just to provide a little bit of clarity around the cases, we've have a number of people that are in hospital and have other illnesses, but they are in an acute hospital bed, but 7 of those patients are requiring oxygen. In the last 24-hour reporting period, we had 418 cases of COVID-19 reported, and the breakdown of that is 355 from RAT tests and 355 RAT tests came from RAT tests, and we saw 1,647 PCR tests processed in that 24-hour period. And Dr. Heggie, who's with me today, will talk a little bit about RAT tests and PCR tests and what Territorians should expect if they're getting tested. On the rolling 7-day average, it's interesting for Territorians to see in the last 7 days we're sitting at 452 cases per day, and the 7 days before that it was 442. So we saw 300 approximately cases on Monday, and then we saw 625 yesterday. So just to provide a little bit of that rolling average for Territorians, you will see fluctuations day to day, as we know, with the cases. The total number of active cases in the Northern Territory has dropped slightly from 4,142 to 4,065. I'll now just turn to providing a bit of a regional breakdown where the cases are in the Territory. We have 2,615 cases of the 4,065 that have a Territory address. Of that, and this is where their address is registered in our system, so they may be other areas in the Territory, but 1,785 are in Greater Darwin and the rural area, 529 are in Alice Springs and surrounding communities, 67 are in East Arnhem, 211 are in the Big Rivers region, and 32 are in the Barkly. I'll now provide the specific updates in the regions within the last 24-hour reporting period. So in Alice Springs, firstly, we have a number of new cases across the town camps in Alice Springs. We've got cases in Abbott's Camp, Little Sisters Camps, Morris Soak and the Old Timers Camp. So we're working with Congress, who provide the health services for these people, to ensure that we're testing and getting in touch with those close contacts. We have got 3 new cases at the Old Timers Aged Care. So there's the Old Timers Town Camp and there's the Old Timers Aged Care. So 3 new cases in the aged care facility, and that brings that total to 18. 10 is residents and 8 are staff. We've got, pleasingly, no new cases at the Renal Hostel in Alice Springs, and there's no new cases in the Alice Springs Correctional Facility. We do have 2 new cases at Percy Court, which is a transitional housing facility, so we've got 2 cases there. We have, in the last 24-hour reporting period, no new cases in Namungana, Papunya, but we do see 3 new cases at Santa Teresa. We've got 10 cases at an outstation near Hermannsburg, and again, Congress are helping with the health services there. We have shared care in Hermannsburg, Nataria, between NTG and Congress. We've got no new cases in Arayonga, but we do see 5 new cases in Utopia. And I'll now turn to Yuelamu and Yuendumu. So yesterday, Yuelamu, we were unable to access in the 24-hour reporting period. We had issues with, there's been quite a lot of rain in Central Australia. The Territory Controller is in Central Australia, and so he's been able to provide this information to the SEMC Emergency Cabinet. But we were able to get into Yuelamu, and there's 7 more cases there, so 22 cases in Yuelamu. Coming across to Yuendumu, we have got issues with the rain. I understand that the runway planes are unable to land in Yuendumu presently, but we're hoping that in the next day or so we will be able to get planes back in there. So we're continuing to see cases spread in Yuendumu. I'm advised that there's 14 new cases in Yuendumu, and we expect more cases in Yuendumu and Yuelamu across the coming days. We have been warning that community for some time that vaccine is the key to protecting them when COVID does come, and both Dr. Heggie and myself have been to Yuendumu and met with the local community and shared the importance of being vaccinated. Their vaccination rate has jumped in Yuendumu, so it's jumped to 83% first dose and 65% second dose. So if you just look back to a month ago, it was 62% first dose and 35% second dose. So well done to the residents of Yuendumu, but we do need everybody to come forward to be vaccinated, particularly the children, now the vaccine is available for them, and also when people's booster shots are needed, it's really important. So it's good progress in Yuendumu, but those case numbers are concerning. We expect them to rise, and so we really need the residents of Yuendumu to understand the importance of vaccination. Moving into the Barkly region, we have no new cases at the Barkly work camp or at the Braddag, which is the alcohol and drug facility there, rehabilitation facility, so no new cases there. Heading up into the Big Rivers region, we have seen a number of cases. We've got 4 new cases in Bulla, and they're across 3 households, as we understand. We've got 2 cases in Larjamanu, and we've got 1 case in Katherine that was at the Watch House overnight. So some cases in the Big Rivers region. And again, a reminder to people in Katherine and Big Rivers to please be really vigilant. There is rat tests available, so please make sure you get tested. In East Arnhem, we have had a continued focus. In Galiwin'ku, we've seen 7 new cases, so that brings the total case number for that community to 34. And we're working with the community. Yesterday we spoke about health teams had headed out from Nhulunbuy to Galiwin'ku. We have had a rapid assessment team head out from Darwin to Galiwin'ku to provide those supports, and police have also sent additional resources, I'm advised, into Galiwin'ku. So we'll continue to test. We've been focused on the close contacts in Galiwin'ku. We'll now work with the community and of course any vaccination that can be provided, but we do have a fairly high rate there. Yirrkala is looking pleasing. We're on track for that lockdown to lift. We've only had 1 new case out of 60 tests in Yirrkala. We did have 2 cases in Nhulunbuy nearby, so Yirrkala and Nhulunbuy, 3 cases in total there. So well done to the residents at Yirrkala. We heard from Dr. Marco yesterday about the fantastic rates of testing and vaccination from some of the outstations too near Nhulunbuy. Heading across to Groote Island, we do have 3 cases that are linked, but they're unknown source of transmission. So they're in Umbakamya on Groote Island. So we've got the 3 communities there. So Dr. Marco is joining a local emergency management meeting as we speak to look at that situation on Groote Island and just to make sure that we protect those communities there. And then heading into Darwin for Territorians as part of the update today, just some specifics in the Darwin area. We are continuing to see the majority of the Territory's cases in the top end in the Darwin region. Of note, there was no new cases at the Darwin prison in this reporting period. We did have a case at the Renal Hostel in Nightcliff and also at one of our sobering up shelters, and also 2 cases at one of the Salvation Army hostel as well. So we've got no new cases at Regis in Tiwi, that's the nursing home there. We had seen some cases. And we do have a case that was an individual who was camping in the Fanny Bay area, and so they have tested positive. The Centre for Disease Control has already undertaken contact tracing with that individual, and we've been able to get into contact with a number of close contacts, and they have been going through a testing process, so we expect more cases there. We're working very closely with Danila Dilba, who provide healthcare, and they're going to send out a mobile team as well to assist with testing. All of those positive cases that may come and close contacts will be transported to the Centre for National Resilience to provide them with safe accommodation, and we can care for them. So a case there. So I'd just like to acknowledge the hard work of not only our health professionals but all of those supporting them. You can see that this is a cohesive effort across the Northern Territory. Many Aboriginal health organisations, many community organisations, and of course the NT government. Many people have been redeployed into different roles. We've got people who might work in a different department who've gone into emergency operations to provide support. We've got people within health who are in different roles, are being redeployed redeployed onto the front line. So we certainly have got an amazing group of Territorians working to provide care. I want to assure Territorians that our hospitals are prepared, our health system is prepared, and our situation remains within scope and of our resources. So we're certainly managing this COVID situation. I'll just speak to, there's been national commentary around the private hospitals agreement. Last year, or 2020 I should say, the Commonwealth across states and territories worked with the private hospitals that if it was needed for bed capacity that could be utilised, and Royal Darwin Hospital has made an operational decision to enact that with the Darwin Private Hospital. So this is an example of our responsible planning and preparedness for the COVID situation. We haven't needed it over the last 20 months, but that has been stepped up. So I'd love to thank the team at Darwin Private Hospital for being agile and allowing us to put this in place. So our case numbers across the Northern Territory remain steady. They remain where we can manage them. Our 2-week average is about 450 cases a day, so you can see that we have flattened that curve, so to speak, and we need to keep managing COVID here in the Territory. So we would encourage Territorians once again to please just make sure you use those public health measures of wearing your mask, physically distancing, using hand sanitizer. If you're feeling unwell at all, make sure that you do a rapid test and isolate yourself. So I'll now hand to Dr. Heggie, who will provide some comments, and we're both happy to take some questions. Thank you very much.
Thank you, Minister. So first of all, I'd like to start by talking about the testing. Rapid antigen testing is a very sensitive test now, particularly if you're symptomatic. PCR testing, it takes much longer to do in the laboratory, and now they can only do one single sample at a time because of the positivity rate in the Territory. But it is useful, particularly when you want to look at the virology, that is the viral load of the person, or indeed the genomics, and I'll speak to that in a short while. So for me at the moment, the numbers give me some comfort. I think to know that ICU is not occupied at present across the Territory, but we do have people receiving oxygen therapy. We know that the deterioration, and I've said this before, that it can occur usually about the middle of the disease, where you go from being slightly unwell to recovering, or your body undergoes an inflammatory reaction throughout the whole body and you deteriorate quickly. So this is really important that we realise that there's a bit of a lag of those ICU presentations and admissions and the oxygen therapy. So we've been communicating and collaborating strongly with Aboriginal Medical Services across the whole of the NT. A lot of collaboration in looking for local solutions, collaborations in how we actually manage the cases. It's become a very complex logistical exercise to move people where they can go if there's large numbers, and clearly Yuendumu got a larger population, and also airstrips and the weather that's in the region that may actually limit the movement of people. So I particularly want to thank everybody who's contributed to this, but it's a moving feast, and I'd say this of Darwin: how many people now know somebody or several people who have tested positive? I certainly can name a number. So it is with us in the community, and we need to be absolutely vigilant about wearing a mask and check in. A number of cases were identified through the check-in app, and then messages sent to others about their potential for being a contact. So particularly what's pleasing is the genomic testing that we have done. We are looking at a 20% delta, more serious in terms of virulence, and an 80% of Omicron. Now the delta is trending down, and Omicron is trending up. Now that can be a good thing, but that's not to say that someone who has comorbidities or lung disease, carries a lot of weight, actually puts them at higher risk, and even younger persons have succumbed because of those other factors. I particularly also want to mention about modelling that would seem that we are seeing the potential for our peak occurring in the first week or so of February, and then a longer tail after that, because in some areas there are low vaccination rates still, and also people who've actually got their vaccine just recently. There's clearly going to be a lag before they get their second dose and then the booster dose. So that doesn't mean that it does mean that you won't have your full protection. So, but this just happens to coincide with a lot of returning Territorians who've been away, and those people are coming here to work. So we have the risk of more incursions occurring this way. So at the moment, what I'm going to say is you really need to consider your movements, who you mix with, and also where you travel to, particularly. There are some rules about having to have a test done before you go to the low vaccinated communities. That's really important. And I'm going to stop and say this to my communities where I've worked in the past. And that's in Utopia and Amungana. And so to the Alyara people, Madra and Katij, Kalamoda Alagana, Yenga Kabatakamara Nankara. I want you to consider not moving at the moment, please, especially Utopia. UMOB, a lot of outstations, just some outstations we've tested and found positive cases. You might need to go to the store, Alpro, or store in the pastoral place, cattle place. So I would say to you, you go there, you get some food, but don't mix. And if you have symptoms, you get tested, ring up that clinic, Yirrkala, that clinic, and then arrange men to come and see you to get a test done, a Lagan. So for all of us, it's around us. Pleasingly, we've not seen the numbers jump up quickly or largely. So at the moment, I've got the confidence to the community that we have our capability broadly across the territory. But it's with us, and please be safe and be careful. Thank you.
Dr. Heggie, just to the modelling that you mentioned. First of all, who performed the modelling? And second of all, how many cases do you envisage will be the peak of this outbreak?
So we haven't, we've done some basic modelling. We haven't got the capability, the Doherty modelling, but using some epidemiology and a very complex calculation, it looks like it doesn't go to the number of cases, it goes to when the peak will occur. And that peak is going to occur at a time when we have more people coming back here, and there's the risk, and people travelling. So that's really the point I'm making when I'm referring to the modelling.
Now, hospitalisations have acute hospitalisations. Has the definition changed? Because they've dropped massively. They were beyond 20 yesterday, now they're 7. How on earth does that happen?
The number of cases in hospital can go up because they need assessment, right, before they can be either go into admission or indeed into quarantine. They also can be there for non-COVID reasons, and in some cases they're carers. There's some people with symptoms that need to be monitored, particularly oxygen levels, and then there's those who actually really need to be there, and that's oxygen therapy. But what's pleasing is the actual number is not so concerning, it's about why they are there.
Okay, sorry, but we had 27 so-called acute cases yesterday in hospital.
Yes.
Now we have 7.
Yes.
How's that happen?
Well, some are discharged into what I said, into the quarantine facilities. The ones that we're talking about, the 7, are the ones receiving oxygen therapy.
Were the 27 receiving oxygen
No.
Well, then how are they also called acute and then these 7 people?
Well-
It sounds like there's been a change in the definition of what acute means.
So just to add further, there's 48 people in Territory hospitals. They're in an acute hospital bed, so it is difficult, and all the states and territories have been reporting and then also saying that there's a number of people in hospital with non-COVID related. So we're just trying to provide some clarity to Territorians so they can understand the illnesses. So there's no one in intensive care in the Northern Territory. There's 7 people receiving oxygen, and there's 48 people in hospital. And as Dr. Heggie was just saying, they come in and out of hospital. They may be taken to hospital, they're assessed, and then they could be discharged to the Todd facility, the Centre for National Resilience, or in fact home. Someone could be in hospital for a short period. So we're just trying to provide clarity. We know the community certainly want to see these figures, so it's about us providing us additional information with those 7 that are on oxygen.
Can I just ask about the case in the Catherine Watch House? Was this person tested when they were taken to the Watch House? Is that how they found out they were positive? And also, what's being done to prevent the spread in a high-risk area like a police watch house?
Yeah, so there's been a lot of work done in high-risk settings, aged care, renal facilities, our correctional facilities, and people interacting with police. So my understanding, and these would be questions for police, but somebody was taken into custody. At that point, they did a rapid test and they tested positive. So we've reported that positive case, but further questions would be police. Tom? I'll go to Tom and then back to Miles.
So the NT News understands that 23 beds of the Darwin Private Hospital were bed board. That's a temporary arrangement.
Yeah.
But it's quite unusual for an entire ward of 23 beds to be bed board. Exactly how much is this costing the NT government to do?
Yeah, so we often have public patients in the private hospital. If we are experiencing a peak in demand within the public hospital, we utilise beds within the private facility. It's normally less than a dozen. What this situation is for COVID is a ward, because we clearly can't mix COVID patients. So this was an operational decision made by Royal Darwin Hospital, as I pointed to, and you've seen in the national media as well as local media. These agreements were reached early on in 2020. I'd be happy to seek some advice around that cost for you.
Galiwin'ku,
Yes.
we've got people not following the lockdown rules at all. We've spoken to locals who say a big error in the government's response here was that there was no rolling translation of that press conference when the first rules were announced. A lot of people are confused about the rules. They still say that there's a lot of issues around people not understanding what the rules are. What's being done about this?
Yeah, certainly we'll take that feedback on board and really appreciate, particularly I know the ABC does do translation of important news messages, so certainly pass that back through in terms of our response. But we certainly have, as I said, boosted resources from Nhulunbuy. There's been additional resources that have gone across from Darwin, and I do understand police are providing additional resources just to make sure, and it's always through an educative approach first, that people understand the rules and what they should be doing in this situation.
The Aboriginal people organisations has now called on the federal government for support, as they describe the NT government's response faltering. I just wonder what you guys make of that, given these are Territory voices that are putting their weight to this.
So there's no dispute between Aboriginal medical organisations, the Northern Territory Government and the Commonwealth Government. We've been working together closely for nearly 2 years specifically on this. We've shared resources. You can see that through vaccine being shared. You can see that through rat tests being shared. But these organisations are funded directly by the Commonwealth Government, and we do need the Commonwealth Government to provide them with the resources they need. But of course, as I just pointed to, there has been collaboration right the way through.
You mentioned
In terms of the private hospital kind of scheme, like most regional places don't have a private hospital, Catherine's have a private hospital, and if it looks like Darwin is starting to reach capacity, what's the plan for if those regional hospitals become full of COVID patients?
So in terms of health in the Northern Territory, we have the regions and they always work independently, but they can access resources, and you see that day to day from the other regions and from the tertiary hospital, Royal Darwin and Palmerston. So in terms of these private hospitals, it's additional capacity at our tertiary facility, Royal Darwin, and so you can see too that we're managing our resources across the Territory. So people have been transferred from Tennant Creek up to Darwin, people are transferred from Tennant Creek down to Alice Springs. So that is one of the operations of the Emergency Management Centre, the EOC, is looking at logistics and what resources are needed where.
So with the Royal Darwin, apparently on level 2, there are 2 wards now dedicated toward COVID patients. One is for confirmed positive cases and one is for likely or presumptive positive cases. Can you explain how we don't know the status of their COVID, if they're negative or positive, why they need to be sort of put into a facility that's separate from positive patients?
Yeah, so right the way through COVID we've managed, and so in terms of the emergency department, which is how most people enter a hospital, we do an assessment, is it a respiratory illness or not? They do those rapid tests and they also then are providing the clinical care to the situation that's at hand, but also making sure that if someone tests positive to COVID or there's a likely chance for them, and people could test negative, but they could come from a situation where they've been a close contact and they may be turning positive. So that is why you'd see operational decisions made on what ward people are best placed.
How many cases are in Ramingining? Have you had any in the last 48 hours there? And why has the local health clinic run out of masks?
I would have to take that on notice in terms of the accuracy of the claim that they've run out of masks. We've got resources right across the territory. In terms of the case numbers, I wasn't briefed specifically on Ramingining. I know we have had cases there, but I'll seek that advice off camera and make sure it's...
You mentioned that if you'll take it on notice, but if it was the case that the clinic had run out of masks, would that be acceptable?
Well, sometimes the media ask me questions and I get back upstairs and I'm advised that it wasn't true. So with all respect, we'll certainly make sure. And you know, we have been managing our resources, as I just talked about, the shared partnership with Aboriginal medical organisations. We have plenty of masks. We have plenty of RAT tests. People should be responsible with them. Don't RAT test every day just for the sake of it. But we certainly, in making sure we have 80 clinics across the territory approximately, and we make sure that there is a supply of resources each and every day.
With the 3 cases on Grey Island,
Yep.
You said that there's an emergency meeting going on
Yep.
right now. Dr. Marco's there.
Yep.
What potential outcomes could be made? What decisions could be made from that meeting? Are we talking a lockdown or a lockout?
Yeah, so it's a local management authority emergency meeting, so you see this type of thing stood up if there's a weather event, for example. In this situation, we've got 3 cases. I understand those 3 cases are known to each other, but it's unknown how they got COVID, so they're just working through that. We do have 3 distinct communities on the island, but they do all interact for supplies, so just making sure that we have all the accurate information on the ground. Dr. Marco's phoned into that, and then he'll then, through our Chief Health Officer, make sure that we're fully briefed, and if we need to make any decisions, we'll do that based on the evidence.
Are you aware of any outbreaks of COVID in supermarkets or distribution centres in the territory?
No, I'm not aware of any.
Will you, first part for you and the second part
Yep.
perhaps better for the Chief Health Officer, will you call on the Australian Defence Force as we have done in the past, or the Territory Government call on the Australian Defence Force? And then just secondly, on the matter of Utopia, we just heard you speak in Ireland language there, I believe, Dr. Heggie, and I wonder, is more restrictions considered around lockout or lockdown there?
So the Northern Territory community should be reassured that the NT government, we have plenty of resources and we are managing where they're going, and we at this point don't need to call on additional resources from the Commonwealth. You have seen that particularly recently with the Tennant Creek lockdown, but right now we're not considering that. On our hand to Dr. Heggie.
Thank you. And to the last question, there's no new cases at Ramingining. And given that we have well over 1 million masks in the Northern Territory in our possession, it may be an issue around ordering masks. So the second part of the question, the strong partnership with the Commonwealth, we've had a meeting with them to talk around how biosecurity measures could be put in place in different parts of the territory, and that would be to restrict movement while we get testing done. So it won't be what we did before at the beginning of the pandemic, which is actually just to stop people moving into or out of remote communities. So that's a proportionate approach. And so speaking to particularly to Utopia, it's 15 outstations and maybe about 800 people. So the important thing there is actually not moving, and but if we see the numbers growing and the partnering with that Yirrkala Health Service is really important, and the Commonwealth to meet the need, and that is to prevent travel, to not spread the virus and get testing done. And I want to say that the rates of immunisation in Utopia have risen, but they went from a few weeks ago from 29% to 39%. So that's the other thing. It's going to take a while before that community broadly becomes fully vaccinated.
Blood watchers nearby, would you consider, if there were restrictions issued to Utopia, perhaps to also apply them to Blood Watch?
Again, I've worked there too. So there is a square kilometre of Mbladawitch community. There's the main access road down the Sandover that could be limited travel to that community. But again, compliance is really difficult when people choose to use a lot of back roads, and I've been on those back roads myself. So again, this would be a measure that we could put in place. Again, it's to protect Aboriginal Territorians particularly from catching COVID and adverse outcomes.
Galiwin'ku, just again on that, they've spoken to the ABC talking about how people feel they're like the Northern Territory government is not really talking to them, and that the kind of restrictions and the way things are being enforced isn't really something that's working in this community. I'm just curious as to what the Territory government's response is to what they're saying.
So as I just said, we take on board the feedback from each and every community, but we have certainly, and I've outlined and I won't go over it again, but a number of resources out to that community, and we take on board that feedback around how we can communicate with them. Thank you, everyone.